Good afternoon, Facebook. How is everybody today? It's Friday. Hope you're all looking forward to having a good weekend. Hope to see a little bit of Mr. Sunshine for the weekend. Let me begin by giving you an update on the number of cases. These numbers are as of yesterday. So the city of St. Louis has 1,593 cases and 95 deaths. St. Louis County has 4,104 cases. That's a combined total for the city and the county of 5,700 cases out of the 10,300 that the state of Missouri has. So that's a little over 50%, just the city and the county and the state of Missouri. On the good news front, though, the 7-day COVID hospital admission rate is down from a high of, it was 59 about a month ago, and it's 28 yesterday. The number of people in the hospital are down from a high of 775 to yesterday, 488. The number of people in the ICU continue to be down. Looking for my number here, 121. Here we go. And that number has gone from, about 5 days ago it was 138, 131, 137, 125, 121. So that number is also coming down. And then the number of people on ventilators, and these numbers are in the region, the hospitalization, ICU, and ventilators. About a week ago there were 108 people on ventilators. Today there are 84. So we are trending downward. That's in the right direction. We're very happy about that because the decision that we made about 2 weeks ago to allow some businesses to crack the door opening on Monday was based on the trends that we were seeing at that time, but they were also dependent on continuing to see a downward trend, which we have continued to see. So we're happy about that. You all know that on Monday evening we issued the regulations for what business can open and under what condition. I think I showed you this. This is all online. This happens to just be I printed it out because it's an easy reference guide for me. But this is all online, and there are very specific guidelines for any business that opens, and they are predicated, those guidelines are predicated on being able to keep a 6-foot distance between employees and between employees and customers and customers and customers. They're predicated on the employee of the business wearing a face mask, and I took mine off, the one I was wearing today. Here it is. I was wearing this little black one that is easy to get on and off, but I've got a collection of them here, and so anytime all the employees need to be wearing masks, and the customers are strongly encouraged to wear masks. Some businesses will decide for themselves that you can't enter their business unless you are wearing a mask. So here's the way I think about mask wearing. It's really not that much trouble. It protects you. It protects your friends and family and the people that you're around. So why not do it? I think one of the key, social distancing or physical distancing is the most important thing to do. But you never know exactly when you'll be within 6 feet of someone, especially when you're out in the public. So it's really important for you to wear masks as well. And speaking of masks, I may have told you last Friday, the city, we finally got a big shipment of masks. They had been ordered for weeks, actually more than a month. We finally got them. We were very thrilled about that. So what we have done is we know that for some folks getting a mask or masks, I'm reaching for something else here, has not been easy. So one of the things that we embarked on is we had small businesses, those businesses that were under 10 employees, signed up, and they got a starter pack. And the starter pack has 20 surgical masks in it, 20 gloves. They come in different sizes, medium, large, extra large, I think. And we passed out about 1,000 of those now. Have we already passed out the whole 1,000?
Well, we have more handing out today and more handing out on Friday. So,
on Monday. Okay, so we started yesterday handing them out in 3 locations. One at 1408 North Kings Highway, one at 3515 South Grand, and one at 1520 Market. So centrally located north, central, and south. I was there yesterday. It was kind of fun to go by and see the small businesses coming in and picking up their starter pack. We know this isn't enough for them to go forever, but it's a way of them getting started. The masks and the gloves are getting easier to acquire, and since we had a big supply, we wanted to start out our small businesses, sole proprietors, people with 2, 3, 5, 9, 10 employees with a starter pack. You can still sign up for that online. It's right on our, it's on our Facebook post, it's on our Twitter post, it's online. So you can still sign up for that if you want and pick up a starter pack on Monday. I think we're doing a landslide business in handing out these starter packs today because of course the small businesses are getting ready to open on Monday. Now that said, a lot of small businesses are not opening Monday, and I've heard from many of them, and that is perfectly fine. In fact, it's probably a good idea. Take a little wait-and-see approach if you'd like. Make sure you have the right PPE. Make sure you're able to follow all the guidelines for your, whether it's a restaurant, a retail operation. There is no requirement at all to open on Monday. But if you're prepared, you may. Now, the other thing that we are doing, since we've gotten this big shipment of masks, is we are making sure that not the small businesses have a starter pack, but we also, and this is happening today, we are delivering to 35 different senior living centers, nursing homes, assisted living, etc. 35 of them, we are delivering masks, 5 masks for every employee and every client, along with gallons of hand sanitizer. And those nursing homes or congregate care homes will be able to put that into smaller bottles and use it for their clients and for their employees. So trying to make sure that those individuals have, those businesses, nursing homes, have enough PPE, both masks and hand sanitizer. The other thing that we're doing is we're distributing about 18,000 masks to Housing Authority is distributing about 15,000, and then we are also distributing anyone who gets Meals on Wheels will get a small pack of masks with an instruction to they should wear it themselves, and if they do have any visitors at all, some of these folks are at home and they should make sure that their visitors wear masks. Food Outreach is getting masks. Housing Authority and Human Services for all of the homeless shelters and places that need masks, may need masks and don't have them. We've also given some masks, a small supply of masks to every alderman, and if they can get more if they need them, just to carry with them, because we know that the aldermen are out and about in their neighborhoods. And I carry masks in my purse, in my bag, and if I see someone who doesn't have a mask, I say, hey, do you need a mask? And I just whip one out of my purse and give it to them. So I think that's good for all of us to do. So we are trying to make sure that everybody has what they need in order to be safe, to keep themselves healthy and to keep the others around them healthy. So that is, that's, I think, the extent of my remarks for today. I don't know if we have any questions or not.
Quite a few questions.
Okay.
Kevin wants to know, well, we have 2 questions about gyms. Kevin's question is, where could somebody send you or send the city guidelines they've developed to safely reopen their gym?
They can be sent to the health department. Do we have the health department email? We'll get it for you.
They could do Restart St. Louis at St. Louis, yeah.
Oh, that's the best place. Restart STL at stlouis-mo.gov.
It's technically Restart St. Louis
Okay.
at stlouis-mo.gov.
Let me try that again. Let me get it right. Restart STLOUIS at stlouis-mo.gov. By the way, that's on our website. I know you all are online because you're watching this online.
And then the follow-up question to that is, when do you envision gyms being able to open? That's a question from Ken.
Ken, we don't know the answer to that yet. Gyms are a tricky business with all the equipment and with all the sweating and with all the breathing hard and all that. But I would really appreciate seeing, it's something that we're considering, because right now, there are gyms in apartment complexes, there are gyms in hotels, there are standalone gyms that people belong to and go to. And I know some of you are really dying to get back to your gym, and you're doing your home workouts, or maybe you're taking a run in the park. So we want to be able to reopen gyms safely.
Does that apply to places like boxing clubs as well?
Yeah, I consider a boxing club a gym. I hadn't thought about boxing clubs, frankly, but I think if we were to ask Dr. Eccles, I think, yeah, a boxing club is a gym. I mean, you're boxing on each other, leaning on each other. That's how the virus spreads.
A question from Morgan. When will the city reevaluate the limit on social gatherings of more than 10 people?
So the social gatherings of more than 10 people applies to individuals. So it mostly applies to a barbecue in your backyard, a kid's birthday party, a party in general at your house or maybe somewhere else, but generally at your house. So that is really for your own safety. It also would apply to if you were having you can't have a big party in a park, a big gathering in a park. And so I expect that's going to go on for a while. There will be circumstances where, like maybe in a banquet room or a meeting room, where under certain conditions, when everyone is 6 feet apart and everyone is wearing a mask, there will be some, and this is a few weeks away most likely, but you will be able to have those kinds of more formalized gatherings. But the gatherings that you just do, a street party, Q in the Lou, the Pride Parade, those things have all been postponed for now because those are just huge crowds. And, COVID's still around, even though and it's around in a big way, even though we are trying to crack the door open a little on allowing businesses to open. It is still a very fierce virus, and if you are older or if you have any underlying health conditions, you should still fear COVID, and you should still certainly make sure that you don't put yourselves in situations where you're exposed to it. We are all trying to learn how to coexist with COVID. And this is part of the process that we're going through now. If these measures that we're taking right now, meaning cracking the door open on some businesses to open, if we end up seeing a big spike in number of cases or hospitalizations and all the healthcare metrics that we're looking at, we'll be looking at another stay-at-home order. And I don't want to do that. I know none of you want to do that. So we got to go slow on this.
Robert's question is, what do we do if we see someone not wearing a mask?
Well, if you know them, offer them one. If you don't know them, I think it depends on how you approach the person. You might offer them a mask, but certainly if they don't want to take your mask, avoid them. Don't get into a confrontation with them. Folks that don't wear masks are much more at risk of having COVID than those who do. So I would avoid them.
Do we have data yet on how many people have recovered from COVID-19?
So, sort of. We know that, I'm going to look at the number here, we know that of the people who were hospitalized with COVID-19, 1,785, and this is people in the St. Louis metropolitan area, have been discharged from the hospital. We also know that there are many, many people, there are 10,000 known cases, 10,300 known cases in Missouri. Most of them did not go to the hospital, but of those who did, as I said, about 1,800 have been discharged from the hospital. And the others, except for, unfortunately, the let me get the right number, 562 people who passed away of the 10,317. That's about a 5%? 10% would be 1,000, no. Yeah, that's about 5%. All the other cases have recovered. Now we know also that we don't know of all the cases because just recently have we begun to get more tests. And so certainly there were people who have had COVID, recovered from COVID, were never tested because we just didn't have the testing capability and the criteria for testing was so stringent. So certainly there were more people that had it and recovered than we know of.
Missy's question is, when is phase 2?
Well, I think what we're seeing now, I don't know what she means by phase 2. I think we're going to be in phase 1 for the businesses that are allowed to open, meaning restaurants, retail, offices, for quite a while. I expect that we will, meaning those restrictions, wearing a mask, social distancing, that's going to be in place. But we may add some business types to the phase 1 who might be able to open in, I don't know, 2 weeks, 3 weeks, 4 weeks. That has not been determined yet. So I wouldn't necessarily call it a phase 2, but it will be that we're starting out small and would likely add some more venues to that.
Gidget's question is, are the hospitals prepared should we have another spike in cases?
Hospitals are prepared. As I said, they only have 400 only. If you're one of the 488, it's not only. But they have 488 people in the hospital today. The highest number that were ever in the hospital at one time, I think it's 775. I'm going to look at this. Well, shoot, I thought I had it here with me, but I'm pretty sure it was 775 on any given day was the highest number of people that were ever in the hospital at one time. The hospital capacity when we started this for COVID patients was over 2,000, 2,500, but the way they got that capacity was to stop all elective procedures and to really slim down the operation of the hospitals in order to make room for what we feared would be the number of COVID cases. Fortunately, because of all of you who stayed home, who socially distanced, it wasn't as bad as we thought it would be. So, you know, if we're cracking the door open and if we begin to see increases, big increases in hospitalizations, in new cases, in number of people in ICU, we will have to step back and stay home again. That's not something any of us want to do, and I don't even want to talk about it, but it's a reality.
2 people have asked, after they've applied for the small business packs of PPE, what do they do to know if they've been approved for their pickup?
So I believe you get an email. Who knows that, right? Yeah, you get an email, and I think when you apply, you tell them where you'd like to pick it up. And if you didn't pick it up yesterday, it's 2:30, almost 2:30, so you'll be picking it up on Monday at one of the 3 sites. So go ahead and go online, and you'll be able to pick it up on Monday.
I think they can just show up too, Steve said, perhaps.
Yeah, so, you know, we'd really like for you to register because we have to account for this money that we're spending, and so we're trying to do a good job of that. If you do just show up, you risk a couple things. One, you're going to risk that we're out because we make up these packets in order to make sure that we have enough for everyone. So yeah, you could try that, but I don't want to promote that too much. Yeah, I know I'm on Facebook, but
Registered people can show up.
registered people can show up, but if you just show up, you know, you risk that we've run out.
So Linda's question is, City Hall is not opening on Monday the 18th, but why do we feel like other businesses can?
City Hall is not being open to visitors on Monday the 18th because City Hall's been shut down for about 2 months, and there are the employees, many employees, not all, but many employees are going to come back to work on Monday the 18th, and there's a lot of things that we have to get in line and catch up on before we have people coming back into City Hall. We are thinking right now, I think I said this on Wednesday, what's in our mind right now is that it might be June 1st or around that time that we have visitors back in City Hall, but it'll be a different visitor experience. When you come in, your temperature will be taken. You won't be able to come in unless you have a mask on. If there's a wait for something that you need to do, you'll be asked to wait in your car, or we do have a few places within City Hall that you can wait and be socially distanced, but you know, we're not prepared to have big crowds of people show up and not be able to socially distance because that's just not something that we can do. So it'll be different.
A few folks asking about rental assistance and what the city is doing to extend the eviction moratorium.
Thanks for that question. So we expect that the eviction moratorium will be extended. It's not clear right now whether it'll be extended for 30 days or maybe even longer. It's still in effect right now until the 19th of May, and we are expecting to get at least another 30-day extension on that.
A question from Maria at KMOX.
Hey, Maria.
Her question is, what is the mayor's thoughts on the proposal about capping the fees on third-party apps, delivery apps that restaurants are using?
Oh, Maria Altman, KMOX.
Maria Kina.
Oh, that's right, Maria Kina, sorry.
Maria Altman's at Public Radio, yeah.
That's right. So, you know, this is a real interesting question. In general, I don't think government should tell businesses what they can charge for their services. On the other hand, we can't have services gouging people and or restaurants during a pandemic. So I think this is, or any time, but certainly during a pandemic. So I think that this is something that's going to have to get worked out. We want these services like DoorDash and Uber Eats, and there are others. A lot of people use these services. Personally, to be honest, I just go pick it up, but a lot of people use these services, but the restaurants need to work with these services, and maybe the consumer, the customer, needs to know. That's one way of looking at this. Maybe the customer needs to know that, oh, I ordered a $10 hamburger to be delivered, and the restaurant's having to pay $3 of the $10 to get it delivered. So I think it's a conversation to be had.
Two people are asking about jury duty, Mayor. Do we know when jury duty will resume? So
I just heard a little bit ago, a few days ago, that jury duty is going to resume near the end of June. I don't recall if there's an exact date, but it's more than a month away.
Sarah's question today, Mayor, is do you know if allowing some businesses to reopen will put an end to pandemic-related unemployment benefits?
Not necessarily. I spoke on Wednesday with the director of the Missouri Department of Labor. That's where you apply for unemployment. So if your business doesn't open for good reason, you don't feel comfortable, you have an underlying health condition, these apply to whether you're the business owner or whether you're the employee, then it's my understanding that you can still receive the PUA, Pandemic Unemployment Assistance. there was something else I was going to say about that. Oh, so it does also have to do with your health condition and your age. If there's a good reason, then according to the Missouri Department of Labor, they will work with you and you would not lose your unemployment.
Robbie's question today, Mayor, do you think most businesses that will be allowed to reopen are going to do everything by the rules and follow the guidelines that are in place, or do you think there is room for improvement?
You know, I'm going to bet on our businesses. I think most businesses will follow the rules, but I think some businesses won't, maybe because they don't know about the rules, maybe because they don't agree with the rules. You know, there's always that factor, and if that's the case, then we'll have to pay those businesses a visit, either literally or with a citation warning letter.
Aaron's question today, Mayor, has there been any input yet on when museums, jewel box, botanical garden, Fox, Muni, Zoo, big type venues can reopen?
We're working on that right now, and it's likely to be a couple more weeks, 2, 3, 4. I mean, that's kind of what we're working on right now. They're not all alike, and one of the things that we have asked each of them to do is to submit their plan to the health director and to show us, well, how are you going to social distance if you're at the zoo or the botanical garden? And some outside venues might be different than inside venues. So that is something that we're still working with the pandemic task force on and trying to come up with some guidelines on that. You know, we just came up with the guidelines for the other businesses 4 days ago. So we moved on to guidelines for large venues, ballrooms, meeting rooms, banquet rooms, museums. We've moved on to that. We're actually talking about that. We've already talked about it a couple of times today, trying to take into account the knowledge that those businesses have, as well as trying to figure out how they can maintain social distancing and keep everyone safe.
Devin's question today, Mayor, can you speak to child care for workers who will be going back to work on May the 18th?
So child care centers are open. Some of them are open now. Right now in the city of St. Louis, child care centers can take care of the kids of first responders, healthcare workers, and grocery store and pharmacy workers. And so on Monday, more will open and can take care of anybody's kids. So if you had daycare before, which I'm sure you did, then most likely they will be reopening. Now they have a lot of guidelines to follow also. The CDC has guidelines for the opening of child care centers. And so that it won't look exactly like it looked before when you took your kids there. So they're opening Monday.
Toby Taylor Hudson from New City School is watching.
Hi, Toby.
Her question is there an update yet from the city on when we can offer summer camp yet? And when will that information be available?
It's going to be available soon. We're working on that right now. And you might know, Toby, that last night, literally last night, the CDC came out with guidelines for summer camps. So a couple people on my staff worked all last evening to sort of, put together some guidelines. We are thinking it'll still be a few weeks before summer camps can open, but get online and look at those CDC guidelines. We'll be putting something out soon because I know parents need summer camp. When my kids were little, I had them signed up for summer camp before about the spring break time, and parents need it, schools need it. Summer camp will look different. Take a look at the CDC guidelines, Toby. Good to hear from you.
Another question, Mayor. How many asymptomatic or random sampling tests are being performed that you know of?
I don't know the answer to that, to how many. There are a couple of studies going on, not all right here in the city of St. Louis, but in the region, mostly by the hospitals and some by the federally qualified health centers who are doing some sampling along those lines. I was on a call this morning with Governor Parson and the mayors, several mayors, half a dozen mayors from across the state, and there have been some limited asymptomatic testing there. And fortunately, and this is anecdotal, but the one mayor who was reporting it, they had, I want to say that he said it was out of a couple hundred tests, they had about 10 or 12 positives. So that is new. That's a new new area of testing. You know, we've been struggling to get enough tests, and the city of St. Louis has now gotten about 20,000 tests that we ordered in March, end of March. We recently just got them, and they've gone to the federally qualified health centers. So not that many for the asymptomatic people, but that's something that's happening across the country, because we all want to know, or we know already that some people who don't have any symptoms, no fever, no cough, no, you know, runny nose, none of the symptoms, can still have the virus and shed the virus and be contagious. That's another reason you guys got to wear your masks. I hope I'm not bugging you with that, but I really have to bug you with it, because you really got to wear masks.
Does the city have specific occupancy limits in place for certain businesses, restaurants, office buildings, hair salons, the places that can slowly begin to reopen on Monday?
Some places have occupancy limits. Restaurants, the answer to that is usually yes. Retail, usually not. And it's been explained to me by the fire department that it depends on how many means of going in and going out, ingress and egress, I guess. It depends on that. And in a restaurant, the reason that they have occupancy limits is that you expect that there's tables and chairs everywhere, which prevent people from quickly getting to, you know, the doors. So some businesses do and some don't.
A question from Robbie, another question from Robbie, Mayor. What are the mayor's thoughts on the Gaming Commission's decision allowing casinos to reopen on June the 1st?
So you saw in the paper a day or two ago, the State Gaming Commission did decide that casinos can open on June 1st, and that's all casinos in the state. There are 13 of them, I believe, will be able to open on June 1st. Couple of thoughts. One, I'm glad that they all are going to open at one time. The question becomes, is June 1st the right date? The reason I'm glad they're going to all open at one time is that, you know, if you only opened half of them, you don't want to send, you know, customers, double the number of customers to a location. The casinos have very strict guidelines as well with regard to social distancing. I've seen the Lumiere's plan, operating protocols, and there won't be nearly as many people in that casino after, you know, during this COVID period as there were before, because they're going to have to socially distance. You're not going to be able to sit right next to somebody else at a slot machine or fill up a table and be close together. They have to operate the casino in such a way that there is social distancing, and you need to wear a mask.
I hope I'm saying this person's name correctly. Alina or Alana, apologies. Her question today is, how can restaurant patrons wear masks while also eating, and what about that protects the employees who work there?
Okay, so let me try to clarify that. I've had that question several times. One, the employee who works there has to be wearing a mask. That's mandatory. And so that is protection both for them, the employee themselves, and for you. Obviously, while you're eating, you can't be wearing a mask, but your server will be wearing a mask. If you read the guidelines, go on our website, and it's right on the homepage. Just click on COVID and go read the restaurant guidelines, and I think you'll have a much better understanding of how that works. So, of course, you're not going to be wearing your mask while you're eating. You're going to be sitting at a table with your family or with your group, and your mask will be off. It's advised that you put your mask back on when you're finished and you're leaving. But your server will have to have a mask on. The menus have to be done differently. Either disposable menus, you know, one piece of paper for each one, or I know some businesses are going to have you look at their menu on your phone or tablet. Or if it's a laminated menu, they'll have to clean them between each table. So this is a matter of your server will be wearing a mask, and that protects you from them and them from you. So.
Can you speak to what the city is planning to use its $35 million in CARES Act funding on that you've received from the state?
So, one, we did receive $35 million last Thursday, I think it was, from the state. That's CARES Act 1. St. Louis County got $174 million from the state, or not from the state, excuse me, from the federal government, because they got their money directly from the federal government. So they got 50% more per person than the city of St. Louis did. We are trying to rectify that right now. I don't know if we'll be successful or not, but we've written letters and had a number of conversations about that. We think that we should be getting about 50 to 3 million in that range, just to be able to have the same funding that St. Louis County has. So what will we use our 35 million on? Some obvious things are tests, masks, PPE, contact tracing, those health-related things. Also, fund housing for the unhoused. As you know, we've added 236, I think it is, beds for folks that were not in shelter. So we've added that. That's very expensive. We'll be using it throughout from between now and the end of the year for all COVID-related things. And we know that, or at least we think, based on what we have heard and know, that we're going to be dealing with COVID at least until the end of this year, and maybe beyond, until there's actually a vaccine for it. So COVID-related expenses is the only thing that we can use it for. That goes, it could be labor, it could be technology, it could be PPE. We expect also to use some of it to help small businesses again. We had one small business program. We expect to do that again. We expect to do some utility assistance. We hope to do some rental assistance. All those things are on the table.
Jessica's question is, where can you currently get tested? She hasn't been able to see her dad since early in the year.
So your dad's probably older and shouldn't have visitors. So I know that there are some urgent care centers, you might look this up online, where you don't have to be symptomatic to get a test. In fact, I even think there's a Walgreens location in the city where you can get a test if you get an appointment. Now, I haven't tried this out because you do have to call and you have to be screened. So I don't know if you can if literally anyone can get a test. I would doubt that. But that is a real struggle, not being able to see your older relatives, moms, dads, and even if you get the test, if they're in a nursing facilities should not be allowing you in to see them.
Mary, you mentioned contact tracing. Can you speak to how that's going in the city? Do we have enough? Are we getting more? And how important that is for reopening?
So contact tracing is very important. Most of us just learned about contact tracing maybe in the last few months, but it's actually a very, very old system that is primarily, before COVID, used with for TB patients, tuberculosis patients, and for STDs. And so contact tracing in and of itself is not new, but it works like this. Someone has test positive for COVID. Then the health department, a case manager person, will talk to the positive patient and find out who have they been around. How long have they been around them? In other words, it takes about 10 minutes is the criteria of exposure within 6 feet. So if you just walk past someone on the sidewalk, no, you're not a close contact. But if you ate lunch with them in the lunchroom of your business and sat at the lunch table, yes, you probably have a significant exposure. So then you have the positive person, they're in isolation, and then you have the people that they have come in contact with. Those people all become quarantined for 14 days since their last exposure. So if you last time you sat with that person was a week ago, well, then you've got a week left to see if these folks develop symptoms. That's contact tracing in a very basic form. The way we do it in the city of St. Louis is through people who contact you. Let's say you're a close contact. You get a thermometer, you get directions, you get instructions to stay at home, to stay away from other people for up to 14 days. Then you have to check in with us twice a day, morning and evening. Morning and evening, we're going to send you an email. It's automated. That email will say, you need to go online now and you need to report your temperature to us and you need to answer these questions about your health. How are you feeling? Do you have any symptoms? Have you stayed at home? You know, those questions. Let's say you don't do that and you just blow it off. We haven't had too many of those, but it's possible. Then there's a red flag that goes up in this system and our people begin calling you. And if needed, they'll be at your door and find you. So that's contact tracing. And you do it in order to isolate the person who's positive, quarantine the people that have been around that person so that nobody, neither the person who's positive or the people around them, are out walking around exposing other people. That's contact tracing.
We're up against our deadline, so
We're already done?
almost 2:45.
Okay.
Maybe final question, what are your predictions, thoughts, concerns about Monday?
Oh, predictions, thoughts, concerns, all
or
three of those.
anything else?
So I think Monday will go fine. I think there'll be a lot of people, a lot of questions on Monday as employees come into work and have to go through the new employee protocol. And it'll take businesses a day or two, to get that all figured out and smooth the bugs out of that. But I do believe that 99% of both the businesses and the employees who work there want to do it in such a way that they stay healthy and that their customers or their coworkers stay healthy. So while I know it'll be disruptive, anything that you do new for the first time is disruptive. People are smart. I think they're, for the most part, going to follow the rules. I also think that customers are smart. And if you are going out on Monday or Tuesday or Wednesday and you walk into somewhere and the employees are not wearing a mask, I think you're going to turn around and leave. I hope so. And I hope you're wearing your mask. So I think, you know, we have to have a little bit of patience with one another. It won't be perfect on Monday, but I think it's going to be pretty darn good. And we're going to learn, you know, by Monday evening it'll be better, and by Tuesday it'll be better. And we have to learn how to coexist with COVID. And there's a learning curve there. This is different than any of us have ever lived in this environment before. So I think it'll be fine. Go slow. It'll be gradual.
Thanks, everyone.
Thank you all. Have a great weekend, everybody. Appreciate you.